Welcome, everyone. Welcome to the Joan Hamburg Show. On the road again, and this time in connection with our partners today, Meridian Healthcare. And lucky you who live in this part of the world, 5 incredible hospitals, and we'll share a lot of that information with you. But we are here at the Battleground Country Club in Manalapan, which, by the way, took us, we were amazed, no time to get here. And today's show is going to be a lot of cutting-edge information on your health, your heart, your stress. We actually have an exercise guru who says that in 10 minutes a day, you not only can become smarter, but I'll show you what he looks like. I mean, when he walked in the room, I said, all right, I don't even have to read your book. I'm sold. So he's going to be along with a lot of other people, but I want to introduce you to Dr. Scott Eisenberg, who's a cardiologist, director of prevention and wellness for the Meridian Cardiovascular Network, and Dr. Sarah Grimley, who's an electrophysiologist. Now, some people listening, what is that? But Dr. Sarah is going to explain. There's so much going on in the world of cardiology. So we'll begin. First, Sarah, explain what your specialty is.
So I'm one of the clinical cardiac electrophysiologists that practices at Meridian. And mostly we deal with arrhythmias, abnormal heart rhythms, whether they're too fast, whether they're too slow. We put in pacemakers, we put in defibrillators, and we do ablation procedures and other studies.
And of course, Sarah, Dr. Sarah Grimley, is also medical director of Meridian Women's Heart Connection. But Dr. Eisenberg, you deal with an area that is fairly new when we talk about health issues, prevention and wellness.
Yes, it is. But just to add to this, we always say there's electricians, there's plumbers, there's contractors, and there's carpenters. So just so you know, so Sarah's an electrician. I'm a plumber as well. Yeah. But and our union's a little bit different than the carpenters, which is the open heart surgery. But yeah, so wellness and prevention is probably the newest field, if you will, in terms of cardiology. It's the traditional is wait for something to happen and really pray that you can fix it. Now we're getting to the point where we want to be able to prevent it from happening altogether.
So first, something that is, I don't know if it would be Dr. Grimley's area or not, but I read something that your group is the first group that has been able to implant this device that is a heart attack detection device. What is that?
I'll pass that off.
So Meridian's involved in a study with something called AngelMed, which is an implantable device that to a patient seems similar in implantation to a pacemaker or defibrillator. And it's for people who have coronary artery disease but don't already have a need for a pacemaker or defibrillator. And the goal is to look for signs of an event and get them to the hospital and treat it faster.
So, which is very interesting, and this group is the first group. But Dr. Eisenberg, you talk about prevention and wellness.
Right.
So, when you talk about this,
right,
is it diet? I mean, everyone says small changes in the diet or whatever, but how do you deal with this?
Well, the approach has to be from desire, and desire to be fit, desire to be healthy, desire to eat right, desire to exercise. Screening is being able to find that disease before it causes a problem. That's prevention. Wellness is being able to do all those things so that nothing bad happens. Now, there's a lot of patients that just don't have that motivation and that desire. What's happened in this area is we've created the Meridian Cardiovascular Network. 5 hospitals, 2 counties, 2 million people.
Wow.
A lot of physicians, 6 physicians that are kind of running, if you will, this particular network and overseeing the best that the Jersey Shore has to offer in terms of screening and wellness.
So when we talk about screening, what are we talking about? CT scans or what?
Well, that is definitely CAT scans are the new wavefront of screening. We can look at plaque, we can score that plaque, and if it's a certain number, it tells us we might be dealing with a lot of blockage, and if it's a 0, it doesn't mean the warranty period is forever. We now know that, but the bottom line is that we can work within about 4 or 5 years to prevent plaque from forming.
So should everyone over a certain age have this? Are we talking about radiation too?
Well, we're also talking about insurance, unfortunately.
Yeah, well, that's the bad word in the medical world.
So, you know, it is a wonderful field, and the low-risk person, and that's why you go to a doctor to get screened. That is that part. We doctors can educate. We doctors can screen. But as I tell my patients, I can take you to water, but I can't make you drink. Okay? Now, the bottom line is that we can make a suggestion to get this procedure done. But the first thing is you walk into a doctor's office. You make the decision, because let's face it, we don't look at prevention is not, this pain will go away. Prevention is, I feel fine. Okay? Yeah, but maybe I have risk. Maybe my family has cardiovascular risk. Maybe someone had a stroke. Maybe someone had a heart attack. People don't think about those things about their family. They're too busy. They're working too hard. You know, they're doing all those things. Not me. It can never happen to me. The Nile is not just a river in Egypt. So, you know, that's where prevention and wellness comes in.
And at what age do you think? I mean, obviously, most 20 or 30-year-olds do not think, oh my gosh, I've got to check out my heart. And yet you hear that kids, 8 and 9 years old, have been diagnosed with high cholesterol with other warning areas.
They just came out today and said if you measure an overweight child's wrist, you can predict the onset of heart disease later on. They just came out. So this happens all the time now, and we're getting closer and closer to trying to get to a younger age group and saying to them, very simple, you have 38,000 17-year-olds, and you follow them for 17 years. If their weight is up, they're going to have heart disease. And that's a big thing that I try to tell my patients. We start them at 20. We start them at 20. Prevention-wise, I didn't say we started with medication, but we start them. Yes.
And it's hard to convince a 20-year-old. But Dr. Grimley, we've all read about athletes recently, too. Kids who seem so fit who collapse on a basketball court or playing football because electrical impulses somewhere get screwed up. How do you know that if you're a parent with an athletic child?
It's very hard to know, and it's very scary because it's sudden and it's unexpected. And the answer is most of it's genetic. Most of this is something that's unpredictable. Making sure your child doesn't have symptoms, making sure your child has a normal EKG, knowing your family history. If somebody in your family has died suddenly at a young age, you've got to be worried
about that. Do both of you recommend in your practice, and particularly in your practice, Dr. Eisenberg, that people take an aspirin prophylactically or only if someone's at risk?
Yeah, we measure someone's risk when they walk in, and that is absolutely false that everyone should take an aspirin. Most of the time, if you have not had anything vascular happen to you or been diagnosed with vascular disease, just taking an aspirin a day generally doesn't really help. I know that there are certain TV shows that have said that in the past, but we actually can do blood work and make a determination of whether aspirin would be beneficial in that category.
And not only that, just last month,
Grimley,
the American Heart Association, the American College of Cardiology came out with new prevention guidelines for women. And women without risk factors such as diabetes or family history, really it's not recommended as a primary prevention measure.
And women's symptoms are very different from their counterparts, right?
They can be. I think we still debate whether it's the symptom that's different or whether it's the description that's different. Whether the way women describe what they're feeling is just different than the way a man would describe the same sensation.
And with women, almost everything hurts all the time anyway, so we don't even think about it. But I want to ask both of you, before I let you go, about statins. Every human being I know over 40 seems to be on a statin, a cholesterol-lowering drug. What is with that?
Well, I actually specialize in that, so I can tell you there's 100 million statin prescriptions a year. And believe it or not, 75 million are given to people who do not have vascular disease. They don't have a stent, they don't have a bypass, they haven't had a stroke. Only 25 million are given it appropriately. Now, out of that 75 million, there are people that are very high risk, and they should. This is why you go to a doctor, to get what we call stratified. Are you low, are you medium, or are you high risk? And therein lies the problem, because we don't want to give that pill to just everybody.
You do not?
You do not, no. It's not the way it used to be. It's not the way it used to be that you have high cholesterol. Whatever happened to exercise and diet?
Well, those are very complicated words.
I know.
You know? No, but do you believe that exercise and diet can...
It's been proven. It's been proven, and I'm sure even some of the panelists that you'll have later on will tell you that that lifestyle therapy can equal that of medical therapy in the right people, especially the low risk and the medium risk people.
Right, because
Absolutely.
I'm sure that if people take statins, then they think it's okay, I can stuff in that corned beef sandwich.
Absolutely right.
Right? So you're very careful about whom you prescribe this to.
Yes, we are.
So it's not the miracle drug of all times.
No, it isn't.
I thank you so much.
Sure.
We're here in Manalapan, New Jersey at the Battleground Country Club, and we are celebrating wellness, which is really essential for everyone. Before anything happens, let's eliminate the possibility. And that's thanks to the doctors at Meridian Healthcare, Dr. Scott Eisenberg, Dr. Sarah Grimley. Much more coming up. Stay tuned, everyone. I'm Joan Hamburg. Welcome, everyone. This is a day that could change the way you feel, the way you eat. You're going to think about prevention and wellness because we are here with Meridian Health. We're at a beautiful country club overlooking a golf course, the Battleground Country Club. And we've got a long way to go, but I want to introduce you to Dr. Telly Vlahos.
Vlahos, that's right.
Vlahos. And Dr. Vlahos is co-director of the primary angioplasty program at Riverview Medical Center, internal medicine, also board certified, interventional cardiology, and cardiovascular disease. And you don't even look that old to have all these credits.
I'm blessed with good genes.
That's good. And Dr. Shadi Yonan, also cardiology. And both these guys understand about prevention, about wellness. But I want to start with you, Dr. Telly, first, because one of the nurses was telling us that you do at this group something really unusual when it comes to angioplasty. Now, maybe it isn't unusual for you, but a lot of people said, gee, we didn't know about that.
Well, earlier today we were talking about prevention and wellness, and we all want to do that. Nobody wants to have a problem, but sometimes things need to be fixed, and I guess, as we alluded to before, we're the plumbers in this equation. So we're the guys who go in there and fix the blockages, sometimes in an emergency situation and sometimes in a more controlled setting. As Joan said, we have a lot of new ways to do it. For people who don't understand, angioplasty is just going in through the artery to the heart, or any other artery for that matter, and fixing a blockage with a balloon. The old-fashioned way, or the traditional approach, is through the leg. Newer approaches are through the arm or even the wrist, where there's a lot less invasive problems and a lot easier healing time. But it's certainly something that we're all trying to avoid, but it's good that we do have the ability to do something about it if the problem gets that bad.
And I'm curious too, and Dr. Yonan, we've heard about stress and the role it plays, but does stress really play a role in heart disease, or is it basically a little bit of your genes, a little bit of what you eat, and your life?
It's probably a little bit about everything. Stress is it's ironic because over many years, I'm sure if you ask any cardiologist who's been in practice, it's one of the first questions a lot of patients will ask is, how much does stress impact them? And I think it's a question that the medical community has avoided for many years and has not really answered until recently. There's definitely stress is a factor. I think if you look at societies, I mean, one of which is in the Mediterranean, if you look at Greece, for instance, they have a healthy diet, they have a low-stress environment in general. They spend a lot less on healthcare than we do, and their life expectancy is almost as good as ours.
Just that their economy is not nearly as good.
But it's true, but we pay a big price for a better economy in many ways.
Well, the Puritan work ethic does a lot for our infrastructure, but it doesn't necessarily do a lot for our health.
I think it's our highways, too, that are doing us in. You know, when you think about commuting, what could be more stressful than that?
No, absolutely. There are many people who live in this area who commute 2 to 4 hours a day to New York, and I think that's a ludicrous way to live.
It's true. But Meridian hospitals are famous for their cardiology, their knowledge, and you do a lot of cutting-edge things in all areas of cardiology. But so many things are happening so fast. So many things are new. People are living much longer. What, for both of you, seem to be the greatest advances, and what's on the future horizon?
In our professional experience over the last 10 to 15 years, the development of stents that we use in coronary artery disease has been really the first thing that's actually improved the long-term outcomes. Angioplasty was originally developed for the heart back in the late 70s, and it was truly a primitive thing for the first 5 to 10 years of its existence, and stents became the one thing that showed a much better long-term outcome. And that, in combination with a better understanding of the disease, better medications, and more aggressive risk management, has improved everybody's survival and functional level.
And do you feel, Dr. Unan, that diet really plays a big part too?
Diet definitely plays a role. I mean, all these things, whether it's stress, diet, exercise, all of it comes down to lifestyle modification. And at some point here in our society, we have to, try to address that as a group, and hopefully we'll be able to do that in the future. Going back to the technology issue that you were asking about, Telly spoke about the advances in coronary disease and stents and so forth, which is excellent. Now the big new initiative is with treating valvular disease. And you have a lot of new devices coming out now where you don't have to have the traditional zipper that people describe where they open the chest fully. They can do certain open heart surgeries now through laparoscopically through 2-centimeter incisions.
Can they? For
certain valve diseases and even bypass surgeries.
Valve replacement?
Yeah.
Like aortic valve or
aortic valve, even mitral valve, all those things are on the horizon.
What a difference that would make.
Should be mainstream in in the next few years.
Is it starting to happen, or you're seeing it more and more? Do you practice it in your groups?
They're still only available in trials, as far as the percutaneous valves go. But within the next few years, that will be an option for some patients.
So
this represents a significant evolution of the process that started with the first open heart surgery 45 years ago, where we can do things that were traditionally very traumatic, very dangerous, and now certainly not routine, but things that can be done in much less invasive fashion. And the next decade, 5 to 10 years, will show even more development in this regard.
Not that long ago, we used to have people from the police department come to the radio station to lecture on all kinds of things. And one of the things that they had told us not that long ago was always carry aspirin in your bag or your pocket if you're a guy. And if you see someone who's having what you suspect might be a coronary event, make sure they get the aspirin. I thought of that when we were talking earlier with some of your peers about aspirin therapy. Does that still hold true?
I think it still holds true. If someone's having problems with chest pain or is suspecting that they're having a heart attack, I still think there's no harm in them taking an aspirin. And that was one thing that we think was done very well here. There was a great public relation campaign for teaching people what signs of a heart attack are, what to do in an emergency, come to the hospital immediately. And the new initiative is to try to get the same reaction with stroke. And you've heard the term brain attack, or some people have heard the term brain attack. And that's the new trend, is to try to get people to understand when a stroke is happening and try to get them to come to the hospital as soon as possible.
Yeah, I mean, aspirin is definitely one of the things we do for people that we suspect are having a heart attack or any type of coronary syndrome, and it's only been proven to be true and only recommended since 1985. So it's only for the last 25 years that we've actually understood it and had it as a formal recommendation as a treatment for heart attacks. So our understanding of the process has really evolved a long way over the last 10 plus years.
Now, people who have valve surgery, they traditionally, earlier in the old days, they were given metal, and they had to take Coumadin with that to prevent blood clots. Today, There's cow valves, pig valves, the whole gamut. Do they last as long, and do you try to treat people with pharmaceuticals instead of operating?
And it depends on the overall clinical situation, the age of the patient, whether they can tolerate blood thinners, whether they have other conditions, what their expected survival is, whether they're even willing to take blood thinners. So it's a complicated decision that really needs to be judged on a case-by-case basis, but there are certainly more options available now than there used to be.
Mm-hmm. And are there exciting new medications on the horizon?
There are. There's probably the biggest advance that people are going to be hearing about is, if they haven't already heard about it, is a new medicine which is an alternative to Coumadin. And a lot of people that are on Coumadin for different problems such as atrial fibrillation with an irregular heartbeat. Pradaxa is a good option. It's called PRADA.
And what is the advantage?
The advantage is you don't have to go for the monthly blood test or even weekly blood test that you're required to do with Coumadin. But again, you have to consult with your doctor to see whether that's appropriate for you or not. And
can people on that eat leafy greens? You always hear people complaining that if they're on Coumadin, they can't eat vegetables, certain kinds.
Yeah, they can. Diet's not an issue with that new medication.
So in a field like yours, things must be changing constantly.
They are. I mean, they are changing very rapidly in medicine. We're both involved in a particular subset of cardiology, so we even have a very, very narrow focus to concentrate on. It's even difficult to keep abreast of the new developments in our little microcosm, let alone the grand scheme of things.
Yeah. So it is fascinating to see what's happening. And are you finding that in a group like yours, which has 5 hospitals throughout the system, it's easy to attract talented young people, or are people so turned off by health insurance and everything?
I think this is an excellent system, and it's a wonderful area to live in. We offer quality care for a wide range of demographics, so it's not as hard as it might seem, because despite the difficulties that are inherent in the evolution of healthcare, it's still a stable, long-term position as opposed to other fields.
Right. And do you both do everything they tell us to do? Eat right, work out? Dr. Shaddy?
Depends on the month of the year. If it's the winter time, I ski a lot. That'll...
Well, that's very good. And Dr. Telly?
Well, I'm of Greek origin, so my diet is usually pretty good. I just need to keep track of things.
Thank you both so much. All the best to you. And thanks to the Meridian Group for letting us talk to these 2 great doctors. Much more coming up after this. Stay tuned. I'm Joan Hamburg.
Thank you.